So today I'm going to be talking about fatty liver and just kind of what my recommendations would be for diet, supplements, and lifestyle recommendations. Let me just get this shared really quick. Okay, so let's talk about fatty liver and what the heck fatty liver is. So fatty liver is becoming more and more popular just because the standard American diet is so high in refined carbohydrates. Fatty liver is reversible. Fatty liver is what happens when fat accumulates around our liver. And a lot of times it is diagnosed kind of as an accident, I guess, as in people aren't exactly looking for it. It's not like you have sometimes people can have abdominal pain, I guess, but most of the time it's incidental is what I was trying to say. A lot of times people will go for routine blood work and their liver enzymes will be elevated. And so then that will indicate that we need to do an ultrasound. And so a lot of times they'll go and get a right upper quadrant ultrasound. And sometimes they're incidental on CT scans and other advanced imaging. So long story short, once you're diagnosed with fatty liver, yes, it is reversible. I look at fatty liver the way I look at people with pre-diabetes or insulin resistance. Those things are reversible before they fully develop and become full-blown diabetes, right? Once it becomes diabetes, then it becomes more of a crisis management situation that's not reversible. That's an autoimmune disease. That's something that you have to take care of for the rest of your life. So fatty liver is similar in the sense that it is reversible. So just through making dietary modifications or taking supplements and lifestyle modifications, you can reverse fatty liver. You can get rid of those fat deposits on your liver before it leads to liver scarring and eventually full-blown cirrhosis. So because fatty liver does eventually lead to cirrhosis in some cases, a lot of people just assume that fatty liver is associated with alcohol consumption, but that's not always the case. More often than not, fatty liver is actually associated with a diet high in refined carbohydrates, sugar, sugary drinks, those types of things. So it's reassuring to know that when you're diagnosed with this, it is not a death sentence. It can be, reversed. And I think what's great about that is that it puts it in our own hands. You don't have to take medication, you don't have to have surgeries, you don't have to do anything crazy and drastic, but you do need to be diligent and change your lifestyle. And so that can be a lot of work, and that's kind of where I come in and I can kind of coach people, encourage them, and keep them accountable. So some things that can cause fatty liver. So number one, obesity or being overweight, especially if you carry your weight here in the abdomen. Excessive belly fat in particular has been linked with fatty liver. As I mentioned before, high intake of refined carbs. If you are insulin resistant already, that's going to predispose you for fatty liver. If you drink a lot of sugary beverages, and then even impaired gut function. A lot of recent studies show that gut dysbiosis or bacterial overgrowth is also associated with fatty liver. So some symptoms, some people may experience some abdominal pain associated with this, some fatigue or weakness, again, elevated liver enzymes, sometimes elevated triglycerides can be an indication, obviously elevated insulin or glucose levels, so you'll want to keep an eye on those. Some people, when fatty liver develops, can experience, the yellowing of the eyes and skin, moderate abdominal pain, nausea, vomiting, and decreased appetite. And so basically weight loss is what's recommended for these patients. This is fatty deposits on your liver, and unfortunately with weight loss, we cannot target fat loss. If we could, all these people would be targeting their belly specifically, or their butt, or their hips, you know what I mean? And unfortunately weight loss doesn't work that way. So you really just have to kind of work on your diet, maybe get out and exercise. And yes, there are some supplements that can help. So in general, if you're trying to lose weight or you're trying to reverse fatty liver, you want to cut back on those refined carbohydrates. So you want to switch to more of like a whole foods based diet, something that's anti-inflammatory, that's going to contain a lot of omega-3s. If I had to slap a name on it, I would recommend the Mediterranean diet for those of you who have heard of it. The Mediterranean diet is basically a lot of seafood, and because seafood has a lot of omega-3s, which is anti-inflammatory, and they have a lot of lean protein like chicken and turkey, and then they're high in fat and low in refined carbohydrates. So yes, there are some grains on the Mediterranean diet, but they're good grains and they're not refined and processed, and then it contains a lot of anti-inflammatory healthy fats. So think of like your avocado, your nuts and your seeds, your olive oils, those types of things. And then of course it's big time in all of your vegetables. So lots of healthy fiber and nutrients and antioxidants associated with the Mediterranean diet. So just to get you started, I would say I would recommend the Mediterranean diet, and it's not very hard to Google Mediterranean recipes and things like that. Another rule of thumb when I'm just kind of working with people, as just in general recommendation, is make sure you have a palm-sized serving of protein with every single meal. That's breakfast, lunch, and dinner. A lot of people get caught up in carbohydrates, and so you'll see them eating like cereals or bagels and toast, pancakes, and those types of things for breakfast. And then they go and they have lunch and they're having a sandwich with a side of chips and fries. And then they go home and they have dinner and they're having like spaghetti or lasagna, I don't know, pastas, or they're having chicken and potatoes. There's always a starch with every single meal. And so that can add up over time. And it's not that carbs are bad. I don't want to sit here and demonize carbs, but I think that some carbs are better than others. In particular, whole foods are going to be better for you. And then if you could just limit your carbs to 2 meals, I think that's a step in the right direction. And, as far as getting started, choose one meal where you skip a carb and just limit it to 2 servings per day. Another rule that I give people when I'm first starting out with them, again in general, is half a plate of vegetables with at least 2 of your meals. So a lot of times this is pretty easy for lunch and dinner. If you're doing smoothies or protein shakes for breakfast, throw in a handful of spinach or super greens or something like that. That's always a great way to kind of sneak in extra fiber and extra vegetables. And then don't forget about your healthy fats. Again, those healthy fats are going to be anti-inflammatory. So you'll want to focus on your nuts, your seeds, nut butters, seed butters, olives, olive oil, avocado, those types of things. So if you're looking to reverse fatty liver, if you're looking to lose weight to reverse fatty liver, I would recommend the Mediterranean diet and those simple guidelines just to get you started. If that does not promote weight loss, then I would suggest working with a nutrition professional so that they can help, address other inhibiting things that could be preventing you from losing weight. Keep a journal, track your food so that you can keep a better eye on what you're taking in. Are you going over or under anywhere? And again, that protein's so important. Protein is very satiating. It's going to keep you fuller longer. So if we can fill you up on protein, then you'll be less likely to overeat on all the other things, right? And protein is going to promote you holding on to your lean mass. So we have lean mass and we have fat mass. And when we're trying to lose weight, we want to make sure that we're really targeting our fat mass. So when a patient comes in to see me a month later and they're down 5 pounds, I often want to know, well, is it 5 pounds of what? I use a body composition analysis so that I can determine that. And, was it 3 pounds of fat and 2 pounds of muscle? Like, that all is going to make a difference. It's going to tell me, A, is my patient doing what they're supposed to be doing when they're off on their own? And B, is what I'm prescribing to them adequate and doing what it's supposed to be doing? So that's diet in a nutshell. There are some supplements that you can take. So green tea is very helpful. Green tea is an antioxidant. It may help decrease fat accumulation on the liver. Taking a fiber supplement. So number one, increasing your fiber through fruit and vegetable intake is important. And then you can also take a fiber supplement. Fiber, I always recommend starting with if it's 1 scoop as a serving, I always recommend starting with a 1/4 scoop and kind of increasing it as tolerated every day. Some people it may take a couple days, some people it may take a couple weeks to kind of get their gut used to that fiber intake. So don't jump right into a fiber supplement at a full dosage. Start with like a quarter scoop and increase as tolerated until you get to a full scoop. Fiber should be taken first thing in the morning, so that while you're drinking water throughout the day, that's going to help with the transit and the motility aspect there. Fiber is great. It may help reduce fat accumulation on your liver, but it also helps reduce or promote, waste removal and therefore weight loss. It can help lower cholesterol as well. Obviously, exercise is going to be a big component of this. Some studies do show that exercise can help reduce fat accumulation on the liver. Again, I think the same thing goes when we're working with weight loss patients. We do obviously recommend exercise for cardiovascular benefits and weight loss, but you can't out-exercise a poor diet. So you have to make sure that you're doing all of the pieces of the puzzle here if you want to avoid this progressing. I think I got off track here. So other helpful supplements, milk thistle and vitamin E have been shown to be very liver protective and may help reduce fat accumulation on the liver. Berberine is great and something that I use often with my weight loss patients to promote insulin sensitivity, and it may even be sort of like an appetite suppressant and promote weight loss, and so that will be good for the liver as well. And then again, those omega-3s. So we talked about omega-3s and how they are high in things like seafood, obviously. You can take an omega-3 supplement, like a fish oil supplement, but you want to make sure that you get a very high quality fish oil supplement. And a lot of times, just the general public usually takes like 1,000 to 2,000 IUs, and sometimes with fatty liver patients, we may recommend more. So it just depends on the individual, but some studies have shown that 4,000 to 6,000 IUs daily for a short period of time have helped reduce high liver enzymes. So phosphatidylcholine is also another supplement that can be used in the short term to reduce those liver enzymes if you have elevated liver enzymes. So I think the takeaway message here is just to remember that this is a lifestyle change. If you want to prevent fatty liver from progressing to scarring of the liver or even cirrhosis. So if you've been diagnosed with fatty liver, this is not a death sentence. You can totally take action. I think it's very empowering to know that if I have a disease or if one of my clients has a disease, that there are things that we can do that are within our control to stop or improve or possibly even reverse the disease. So I think that's very empowering, and I want to encourage anybody out there who may have this to take that message home with you and just kind of work on improving your diet. Slow changes over a period of time are going to lead up to something big. So just kind of start with controlling your portion size, start incorporating, removing the refined carbohydrates, reducing your carbs, 2 per day, increase that protein, add more fruits and vegetables, consider some of these supplements, get out and exercise, even if it's just going for a walk for 15, 20 minutes a few times a week. Like, that's a step in the right direction. And every week you can just kind of add on 5 minutes and slowly build that up into a lifestyle change for you. So if you have any questions, I'm happy to answer. If you're interested in any supplements, of course, reach out to me and I can do my best to guide you where to find special supplements that can help you. And then of course, check out the Mediterranean diet. There's a lot of great resources on Google. I'll post a couple links in the comments below for you guys. All right, until next week, I'll see you later.